a patient's being treated there and a medical doctor is treating them and thinks that they need a consultation with a psychiatrist, your department would be called.
That's correct.
Okay. And how long have you been with the Brigham?
19 years.
Now, I want to direct your attention to January of 2023. Did you interact with a patient named Lindsay Clancy?
I did.
And was that on January 29th, 2023?
Yes, that was the first of a handful of times that I saw her.
And why did you meet with Lindsay Clancy on January 29th, 2023?
Yeah, so my team was seeing Ms. Clancy for a number of reasons, including for psychiatric safety risk assessment. She had come in reporting a suicide attempt, which is a common reason why my team would be called, is to continue to ensure that patients are safe when they're in the hospital. So we make recommendations about kind of safety status, what can we do to help keep a patient safe, but then we also make recommendations related to medications. So that's why my team was following her. So that was one of the reasons why I saw her on the 29th, is to continue that assessment. I was also called to ask I was asked a new question that day, a consult question on whether she was able to make the decision to change her healthcare proxy from her, at the time, husband to her parents.
And
yes.
When you consult to help determine whether someone's capable of making a decision like that, changing their healthcare proxy, are you evaluating their medical decision-making capacity?
That's correct.
Okay. How do you go about doing that?
So there's generally 4 parts to medical decision-making capacity. The first is whether somebody's able to voice a choice and whether that choice is consistent over time. The second is whether they understand the situation under which they're making that choice. The third part is appreciation of the risks and benefits. And the fourth part is kind of being able to reason or rationalize that information to be able to come to a choice and how they came to that choice.
Now, if you're doing this evaluation to determine someone's capacity to make decisions, would a traumatic brain injury factor into that evaluation?
It could.
When you evaluated Lindsay Clancy, was she able to voice a choice to you about who she wanted to be her healthcare proxy?
Yes.
And is she speaking to you or writing this down?
She's speaking.
Speaking. So she's already been extubated at that point?
That's correct.
And she's speaking to you, and were you aware that Patrick Clancy was her healthcare proxy?
I was told that by her primary medical team.
Okay. And when you talked to Ms. Clancy, did she tell you who she wanted to take over that role?
She did.
And who was that?
Both her parents.
And you talked about that needing to be a consistent choice. How did you ensure that was a consistent choice with her?
Yeah, so we waited to make the change from Patrick Clancy to her parents until the next day for a variety of reasons. We wanted to ensure that that choice was consistent over time, and especially because the day that I saw her, she had just gone through some pretty major medical events, including she had a major spine surgery, a decompression and a fusion. She had gone through some oxygen desaturation overnight, so was not breathing as well. Her heart rate was up, all of which then led to her being what we call delirious. She was confused overnight to the point where she asked her nurse, "Am I delirious?" And she was also experiencing some visual hallucinations. So that was one of the reasons why I was called in, to make sure that she was able to make that decision to change her healthcare proxy. And then in addition, the team had also voiced.
I just want to pause right there. Very interesting that, Lindsay Clancy goes through all of these, from delirious to psychotic to postpartum, and she can always relate those symptoms. Am I delirious? Am I depressed? Am I psychotic?
Concerns that she had come in after a report.
Let's get into it.
recorded suicide attempt, and so making sure that she was able to make that decision of sound mind. And so we actually waited until the next day when she could be reassessed. At that point, her delirium had cleared, and she was continuing to make that consistent choice to change her healthcare proxy to her parents.
And in fact, you noted in the medical records that the hallucinations were part of an issue with oxygen.
It could be. That could be one of the reasons. Delirium is usually due to a variety of different medical reasons, and oxygen desaturation could be one of them. She had also just recently had anesthesia related to a surgery that she had on her spine, so that could be another reason. And then her heart rate was also actually quite elevated, so that could be another reason.
Is it common for patients who are just coming off of anesthesia from surgery, who have an issue with oxygen and other medical issues that you described, to have visual hallucinations?
They can. It's not that everybody does, but they can. And delirium can be quite common after surgery, and particularly anesthesia.
And those hallucinations that she was having, those were resolved by the next day. They were over by the next day, correct?
That's correct.
And her choice to change her healthcare proxy to her parents was consistent the following day, correct?
That's right.
You also talked about the patient has to understand the risks and benefits of the decision, correct?
That's correct.
How do you make sure the patient understands that?
Yeah, so one of the things we do is really ask patients to take us through their thought process of why they're making that decision and what led to them making that decision at that moment in time. So we're able to kind of see their thought process and ensure that they're understanding, what it means to remove one person and add another.
And what was Ms. Clancy's thought process in explaining that to you?
Yeah, she was saying that her parents are quite supportive to her, and that she was thinking that she would have to change her healthcare proxy from her husband to somebody else. And we didn't necessarily go into the reasons as to why she would have to change it, but she explained that she was very close with her parents. They would see each other frequently, given that they lived in close geographic proximity, and that she felt that they were very supportive to her and would have her best interests in mind should we need to invoke the healthcare proxy, or that if she couldn't make her own medical decisions.
So was there a concern on her part that her husband wouldn't have her best interests in mind at that point in time? You also talked about the patient. You have to make sure the patient's thinking about the information rationally. How do you go about doing that?
Yeah, so one of the things we do is really ensure that the patient understands the situation and all of the kind of parts around it. So this comes into play much more when it's about a specific medical intervention, like an invasive.
All right, Nurse Gang, I just want to chime in right here right quick. I want everybody to chime in the chat. She is still, with all she went through medically, because we're not denying, she had spinal surgery, all these things, she still clearly and calculated she wants to not live anymore, and she knows her parents will respect that wish, but she knew her husband was going to make sure she stay alive. She's still very calculated. What are your thoughts? Let's go back in.
It's a medical procedure, or something like an amputation or a surgery. With a healthcare proxy, one of the things you want to make sure is that the person that they want to change their healthcare proxy to or appoint as their healthcare proxy makes sense in the context of their life. And Ms. Clancy was able to talk about how her parents were quite involved in her life, and so that's one of the things that we would assess.
And then the last thing was making sure the patient understands the risk if the change doesn't happen. Mm-hmm. Did you go over that with Ms. Clancy, and how did you do that?
Yeah, I did go over that with her.
Before we go into what the doctor went into, we got ICU nurse in here at Ellen, MR1BW, who says, she's an ICU nurse, and patients do get delirious for many reasons, but they don't wake up saying, am I delirious? Let's get into it.
We talked a little bit about how it could mean that she would not have a healthcare proxy were she not to appoint her parents. And so we went through that, it's always in healthcare, we always talk about how it's great to have a healthcare proxy just in case you become unable to make medical decisions, and who would you want that to be?
And during this conversation with the defendant, going over all these points, did you ever have difficulty understanding her?
I did not.
Did she ever appear to have difficulty understanding you?
So the first day when I saw her on January 29th, she described herself as feeling confused, and I definitely witnessed that as well. We went through a bedside cognitive evaluation, and she definitely made some mistakes on some of the cognitive evaluation. Therefore, I did diagnose her at that time with delirium.
And then she was re-evaluated the following day, and there were no issues with her understanding, and the delirium was gone, correct?
That's correct.
And were you aware during this evaluation that Ms. Clancy did not have a brain injury?
I'm sorry, can you repeat the question?
Were you aware that Ms. Clancy did not have a brain injury at that time?
One of the things that we look at is any kind of relevant medical information that might be available to us, and I noticed that her Glasgow Coma scale when she was transferred to Brigham and Women's Hospital was a 10, which would indicate that she could potentially have had a moderate brain injury, but I don't recall thinking about whether, specifically whether she had a brain injury.
Were you aware that a CAT scan was done, page 110 of the records, and
Whoa.
What's that?
I just built a budgeting app in Base 44.
Guys, Nina just built an app.
Impossible.
Nina can't code.
Ads.
on the CAT scan, the impression was no acute intracranial findings, so no brain injury.
So
On
you
the
can.
CAT scan, correct?
I did review the head imaging that was available at the time. You can have a normal CAT scan and still have a brain injury.
Were you aware that she had multiple CAT scans that showed no bleeding in the brain, no skull fractures, no injuries, just visible injuries whatsoever?
I'm sorry, but can you repeat the question?
Were you aware that she had multiple CAT scans at South Shore Hospital and at Brigham and Women's that showed no skull fractures, no intracranial bleeding, no hemorrhaging, no visible damage whatsoever?
Yes.
Okay. And were you aware that she was evaluated at South Shore Hospital and at the Brigham, and she had no external injuries on her head either?
Yes.
Now, she was allowed to change her healthcare proxy to her parents, correct?
That's correct.
So if someone was had an injury, a brain injury, to the point where they didn't know what was going on, or they were having trouble processing or thinking, they wouldn't be allowed to change their healthcare proxy, correct?
It depends to what extent. Most patients that have either a head injury or severe mental illness, let's say, just anything going on with the brain, retain the ability to make most medical decisions.
Yeah.
And we think about changing healthcare proxies as a pretty low risk decision. As I mentioned before, something like an amputation or a major surgery, invasive procedure is something that we would hold somebody to a higher bar, but a healthcare proxy is a pretty low risk, especially if it makes sense in terms of who they want to change it to.
And when was her Glasgow score 10?
I believe it was as she was being transferred from the outside hospital to Brigham and Women's.
And you're seeing her several days later, correct?
Correct.
And so when she was transferred from the outside hospital to Brigham, she was unconscious, correct?
So I just want to pause really quick. The prosecution is really honing in on this brain injury because in the opening
I believe
statement
so.
from her
So now she's
psychiatrist, he said that she went out the window head first. So she's trying to establish that
correct.
there's no
That's
brain
correct.
injury.
And when she was transferred from the outside hospital to Brigham, she wasn't communicating or speaking or opening her eyes on her own, correct?
That's what the report said. I was not there at that time, but the notes that I read, that's correct.
So when you're speaking to her a couple days later, she's opening her eyes, she's communicating, she's responsive, she's interacting, correct?
Yes.
So it's fair to say that her Glasgow score would be higher than the 10 when you were speaking to her, correct?
Yes.
Doc looks nervous.
Now, you did a mental status examination of her while you were
Here we go.
doing this evaluation about her decision-making capacity, correct?
Yes.
And it's fair to say under mood you listed okay,
Yes.
that you listed her thought process as organized, goal-directed. Is that correct?
Yes.
You asked her if she was having hallucinations or delusions, and she Other than those initial ones, the first day, she denied those?
During my evaluation, yes.
And she also denied
She got cured.
suicidal intent and homicidal intent, correct?
Yes.
And you listed her insight and judgment as fair, correct?
Yes.
Her behavior was calm and cooperative?
Yes.
And you didn't see anything about her behavior that would indicate to you that she was responding to some type of voices or hallucination that you couldn't see?
At that moment, no. But as I mentioned, I did speak with the nurse beforehand, and Ms. Clancy was able to report to me that she reported visual hallucinations overnight.
Overnight after surgery?
That's right.
Okay. And then never again?
Not during my evaluation.
Okay. And did you
Surgery nurses in the chat. Is it normal to have these visual
Ms.
hallucinations
Clancy again
after surgery? Respond in the chat, please.
on February 19th, 2023?
Yes.
And was the purpose for that to prepare her for a transition from Brigham and Women's to Spalding rehabilitation?
That was one of the reasons.
Okay. And what were the other reasons?
So it was an ongoing safety evaluation, ongoing evaluation of psychiatric safety risk, as well as medication evaluation to determine if her medications were at the right level, the right dosage, and that she was on the right medications, and then just ongoing evaluation in terms of kind of her mental status.
And during that meeting, she denied suicidal intent, correct?
That's correct.
She denied homicidal intent, correct? She denied having auditory or visual hallucinations, correct?
Yes.
Y'all, you can get 30.
Please hit the like and share in the chat. Doctors getting into the mental health evaluation now. This is what we all have been waiting for. Let's get to it.
Spalding, correct?
Yes.
She also denied any confusion or disorientation, is that correct?
Yes.
And again, you described her mood as okay on that day?
Yes.
And you described her as future-oriented on that day?
Yes.
And then you spoke to her again on February 21st, 2023, is that correct?
Yes.
And on that day, is this the same purpose that you just described, getting
So almost a month later.
her ready, assessing her mental status and getting her ready to transfer to Spalding?
Yes.
Okay. And during that time, you wrote that the patient reported feeling down about her current situation, her paralysis, and the events leading up to her hospitalization. Is that correct?
Yes.
And you also noted that she said her thoughts about what
She was feeling down. Very, very interesting about her paralysis, but excited to go to the rehab facility.
she had done were not constant throughout the day, correct?
Correct.
So she wasn't thinking about killing her children throughout the day, every day, correct?
Correct.
And she said she had no suicidal intent, no homicidal intent, correct?
Correct.
No auditory or visual hallucinations, correct?
Correct.
You also write no PI. What does PI stand for?
Paranoid ideation.
And there was none of that either.
Correct.
You also made a note, notes low mood today in the context of her physical and legal situation, but does not currently meet criteria for major depressive episode. Is that correct?
Yes.
So her focus seemed to be on her physical and legal situation, but being hopeful about moving on to Spalding.
Could I see counsel?
So it looks like very interesting that she wasn't diagnosed with depression in the hospital. this court has a lot of sidebars, so right now they're on sidebar, but it's very interesting that none of the symptoms that led up to this, you know, what her defense attorney is saying, in the hospital, nothing. And you would think that if you were in the hospital, you know, paralyzed, that you know, would be very depressed. That's a reason, you know, another reason to be depressed.
And where do you work currently?
I work at Brigham and Women's Hospital.
And what is your role there?
I'm Associate
So
Chief
what
of
do
the
you guys
Division
think
of Psychiatry and
about,
Med.
what she's saying at this time, the psychiatrist? Let's drop it in the chat, because I feel like, and she, you know, she is testifying for the prosecution, but she's not really, she's just keeping it kind of like, you know, just matter of fact. She's keeping it matter of fact. Let's go back.
I did not know that the first time I saw her, because those labs take a little bit of time to come
Sure,
back.
and you treated her for about a month, so you were pretty
That's
close to
right.
her and got to know her quite well.
Yes.
Would you agree with me that one of the things that her blood reflected or that she was on was Trazodone?
Yes.
And can you tell me what Trazodone is?
Yeah, Trazodone is an antidepressant medication. It's more often utilized as a sleep aid because of one of the side
Her attorney is setting the
effects
stage
is sedation.
for her being allergic to SSRIs.
And so patients that are often having difficulty sleeping are placed on Trazodone.
And is Trazodone, does that share some of the qualities of what are referred to as SSRIs, even though, or SSRI, even though it's not an SSRI, it shares similar qualities?
Yes.
Can you tell me what SSRI means?
Yeah, so that's a selective serotonin reuptake inhibitor, and it's a class of medications that are antidepressants.
And the SSRIs, that would also include Zoloft, for example?
Correct.
Would also include Prozac, for example?
Yes.
Are you, as a psychiatrist, aware that Zoloft and/or SSRI Prozac should not be prescribed to a patient who has bipolar?
Yeah, it can be prescribed. Oftentimes it's prescribed together with another medication that can be protective because patients with bipolar disorder may be experiencing depression, and so they may be
Hold on, Nurse Gang. We got a break right here.
prescribed an
I knew it.
antidepressant.
I said he was
but
setting
along
the stage.
with another
he was setting
medication
the stage for to say
that
she had a
we call
reaction to the
protective.
SSRIs.
And
Because she was bipolar, she was misdiagnosed. This is where he's going with it.
in reference,
This is where he's going with it. I knew 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 it. So basically, Kevin Reddington at this moment is going down, you know, the rabbit hole to say that she had a reaction, that she was misdiagnosed. She really was bipolar with psychotic features, and the SSRIs is what she had a reaction to. Because remember,
to the
in the beginning,
You travel a lot.
in the beginning, they talked about Zoloft being one of the first drugs she was on. And she had a reaction to it. He's been going on and on with these SSRIs. So I think he's setting the stage to say that she was bipolar with psychotic features. I am looking in the chat. Bipolar with psychotic features. And she had a reaction because they weren't giving her the right meds. All right, let's
reuptake
get back to
inhibitor.
it.
What does that mean?
Yeah, so oftentimes in depression, patients are
What is wrong with this? Hold on, chat. Bear with me. As I was saying to you guys in my other chat, like, Kevin Reddington
Reference to the
is
SSRIs,
very, very,
the
very
selective
good.
serotonin reuptake inhibitor. What does that mean? Selective serotonin reuptake inhibitor. What does that mean?
Yeah, so oftentimes in depression, patients are kind of lacking serotonin in the spaces in their brain that helps
Can I
with...
interrupt you? What is serotonin?
Yes, serotonin is a neurotransmitter, so it's a hormone in the brain that works on the brain. It works in other areas in the body as well, but for these purposes, it works in the brain, at nerve endings, throughout the body. And that neurotransmitter helps with things like mood regulation. For patients with depression, they're often lacking kind of that ability to have enough serotonin in those spaces. And so a selective serotonin reuptake inhibitor prevents serotonin being kind of sucked back into the cell. So it allows for serotonin to be more available.
And what is an SSAI? What does that mean? Antagonist, selective serotonin antagonist.
So those are medications that kind of do the opposite.
Okay. And you knew, as a psychiatrist, at least looking at her history, you knew that she had been seeing psychiatrists immediately prior to her suicide attempt, correct?
Correct.
And you knew that she had been prescribed a number of drugs by these various psychiatrists, correct?
Correct.
And to your knowledge, was she prescribed diazepam?
Yes.
Valium? Was she prescribed buspirone, otherwise known as
She wasn't taking the boost bar, though. Come on,
Yes.
Kevin Reddington.
about Wellbutrin?
She
Yes.
wasn't taking
And what
the
is
boost bar.
Wellbutrin? Is that an antidepressant?
It is an antidepressant.
Hydroxyzine. What is hydroxyzine?
It can be used for a number of reasons, but for psychiatric purposes, it's often used as an anti-anxiety medication.
And Klonopin.
Yes.
Benzodiazepine.
Is hydroxyzine, is that a, strike that. Klonopin, that's a benzodiazepam, right?
That's correct.
And then lamotrigine.
Yep, lamotrigine.
Lamotrigine, sorry.
Mood
Yes.
stabilizer.
What type of medication is that? Is that a mood stabilizer?
It is, yeah. It's also an anti-seizure medication, but in the psychiatric realm, it's used as a mood stabilizer.
And then we talked about Prozac, that's an SSRI, correct?
Correct.
And what's Remeron?
Also an antidepressant.
Antidepressant.
So in addition to all of the drugs that I had mentioned, she was also prescribed Remeron, correct?
Correct.
She was also prescribed Seroquel or quietapine.
Antipsychotic.
Yeah, quetiapine, yes.
That's an antipsychotic. He's going with she was bipolar and she was misdiagnosed and had a reaction to the SSRIs.
Quetiapine, okay. And what is Seroquel?
So Seroquel is an antipsychotic medication.
And she was prescribed, as we already talked, Trazodone. Was she also prescribed amitriptyline?
Yes.
What is amitriptyline?
Amitriptyline is one of the older antidepressants. It's a tricyclic antidepressant that can often be used to help with sleep, but also mood.
And Ambien, correct?
Correct.
And Zopidine.
Yeah,
That's
Zolpidem
Ambien.
is the generic name of Ambien.
That's
Oh,
Ambien.
okay. Some of these drugs, they also have what's called
He's
a
still in the
suicide
med
warning
days.
or a black box warning. Isn't that right?
Yes.
Can you tell me what that means?
Yeah, so in studies that have been done, some of them show that especially after starting an antidepressant, it can increase someone's risk of suicidality. Many of those studies showed that it was mostly in adolescents and young adults, but it can happen in adults as well.
And Celexa was also a drug. Is that an SSRI too?
It is.
And all of these drugs that we just went through were all prescribed
He's going
from
with the SSRI.
September, end of September till January.
Yes, September 2022.
4-month period.
Yes.
It's an awful lot of drugs to be prescribed in 4 months, isn't it?
Sustained.
He was trying to get her to
Thank
throw
you.
the other psychiatrists under the bus.
Websites your competitors don't want you to know.
So
All you do.
can't do anything about these ads, but so basically he's setting the stage for the fact that she was getting SSRIs and she had bipolar, she was schizoaffective. This is exactly what he was saying, but we need the toxicology report because of the simple fact that we don't know everything that she was on. I didn't even know about the Celexa. The Celexa is different. That's new. Let's get into the forensic psychologist. I'm looking in the chat. Let's get into the forensic psychologist. And let's see what she says. She's going to get more into, you know, she's going to get more into, he's going to really hammer her on whether this was, you know, bipolar or not. Let's get into it with, you know what? First, let's go over to the emergency room physician. Let's go into it.
Emergency medicine physician.
And how long have you been a physician?
11 years.
Can you tell us a little bit about your educational background?
I went to medical school at the University of New England in Maine. I did my residency at Kent Hospital in Rhode Island. I subsequently worked at Kearney Hospital in Dorchester, and I've been at South Shore Hospital since 2021.
And in what, are you primarily in the emergency department at South Shore Hospital?
Correct.
Have you been in any other department at South Shore Hospital?
No.
Are you licensed to practice in Massachusetts?
Yes.
I'm going to draw your attention to January 24th of 2023. Were you working in the emergency department that evening?
I was.
At some point, were you advised that a patient was being brought into your emergency department?
I was.
And were you aware of that patient being Lindsay Clancy with a date of birth of 8/11/90?
Yes.
And what kind of information were you given upon learning that the patient was coming here? What were you expecting to receive?
I was expecting a trauma 1 response, a patient who had fallen out of a window from a height and didn't know much more than that.
Okay, and so when you say trauma 1, what does that mean for you?
So we had 2 designations for trauma responses, a trauma 1 and a trauma 2, and there's certain criteria for each. And there's a long list of criteria that are determined by the resource nurse who receives the EMS call.
Okay, and so when we say 1 and 2, which is more serious than the other?
Trauma 1.
Okay. And so what do you do to prepare when a patient is coming in and you know coming in that it's likely a trauma 1 situation?
So we gather in the trauma room and make sure that we have all available staff needed to take care of.
The prosecutor has to land the plane. I mean, she just has to land the plane. Like, come on.
For the patient.
And what kind of staff are with you in the room, in the trauma room?
So for a trauma 1 response, it would be the emergency medicine physician. It would be anesthesia, the trauma surgeons. Sometimes neurosurgery will be there.
And fair to say you also have a whole host of other staff, including nurses, emergency room techs. All of those people are also available to assist if you need it.
Correct.
Now, when this individual came in, when Lindsay Clancy came into the emergency department, were you aware from EMS that she had already come in with some sort of neurological deficits?
I think that from my best recollection, we knew that she was unresponsive, found down outside of her home.
Okay. Were you advised that it appeared she might have a spinal injury?
Yes.
And that she was not she may have been moving her arms and her head, but not her legs.
Correct.
Now, when the team was assessing her in the
They knew she was paralyzed right off the rip.
Emergency department, what types of steps do you take to perform that assessment of the patient?
So there's a series of steps that we go through to assess a trauma patient that are followed every single time. ABCs, airway, breathing, circulation, and then we do a secondary survey.
Okay. And in this circumstance, was the patient breathing?
Yes.
And when she came into the emergency department, was she breathing on her own or intubated?
She's breathing on her own.
At some point, did the ER staff have to intubate her?
Yes.
And why was that?
For airway protection, There was a concern that maybe she would have a head injury and she would decompensate later, and so to protect her airway, she was intubated.
Now, is that a standard protocol when there's concern for head injury?
Yes.
Did you see any obvious signs of a head injury when she arrived into the emergency department?
No.
What kinds of things would you see if somebody had an obvious head injury?
You might see bleeding or lacerations or abrasions.
Now, did you observe any other obvious injuries to this patient?
I did. She had some superficial lacerations of her neck and wrists bilaterally.
Do you recall if she came in on a backboard with a C-collar?
She did.
And do you remove the C-collar at some point to assess?
So there you have it. The emergency room physician said the cuts were superficial. That is all the prosecutor needed from the beginning. She didn't need 10 cops to say the bandages weren't bleeding. The cuts were superficial once she got to the ER. That's all she needed from the beginning.
The patient for injuries?
We didn't completely remove it temporarily to visualize and feel her neck and then put it right back on.
Okay, and you said you did observe some injuries to her neck, correct?
Yes.
I'm just going to show you some photos that have been already marked, if that's okay, on the screen next to you.
I dare you to let me build you a completely free e-commerce store preloaded with 20 handpicked products that are trending all over the world.
Any graphic images, got to make sure that they're not showing anything graphic. Can't have that on the YouTube here. Interesting question from the chat. Do we know if she OD'd before she jumped out the window? I'm not sure.
As the
Interesting question. Let's go back.
The CTs for her head, were there more than one CT test for the head?
I don't remember. I'd have to look at my record.
Well, what are the normal, or what are the options for CT head scans?
It's usually just a CT head plane, but you could also do a CT angiogram, depending on your concern for injury.
And do you recall which one you ordered here?
For a trauma one, it would be a plain CT head.
And why do you order that particular test?
Well, we're trying to assess for skull fractures, intracranial bleeding, things like that.
The prosecutor right now is setting the stage, getting the emergency room physician to back up her claims that Lindsay Clancy did not go out head first. She didn't have a brain injury. And of course, the cuts were superficial.
And when you say a plain CT, what's the exact order that's put in for that type of a CT?
CT head.
Okay, and are there CT heads with contrast?
There are.
And are there CT head scans without contrast?
Yes.
Okay. And approach the witness. I'm going to show you some documents, if that's okay.
Sure.
I apologize, there's no series of pagination, so I'm just going to draw your attention to this page that's black. If you could just take a look at it.
Sure. Mm-hmm.
She's showing her notes.
Okay, and I'm just going to flip to the next page as well. The next page is blank, but is this the extent of what you would have received as far as information regarding a head CT that was done without contrast?
Yes.
And I'm going to just...
the head CT must have been negative.
Another flagged page here towards the end.
Looks like the head, I think she's probably going with the head CT was negative.
2 pages from the end of the document, if you could take a look at that.
Mm-hmm.
And does that reflect the report you would have received for the head CT ordered with contrast?
Yes.
And in addition to getting a report from imaging, you also receive some actual images, correct?
Yes.
And do you review those?
Yes.
In this particular circumstance, when it came to the patient of Lindsay Clancy, was there anything remarkable in either of those head CTs?
Not that I recall.
And in fact, the head CT with contrast indicated the impression was unremarkable. CTAF had no
The psychiatrist
evidence, intracranial
The
aneurysm.
psychiatrist did just say you could still have a head injury. That was her testimony. You could still have a head injury with negative CT. Let's see what the ER doc says.
Arteriovenous malformation or abrupt occlusion, correct?
Correct.
What does that mean?
It essentially means it's a normal study.
Now, as far as the other CT scans that were conducted, there were findings, remarkable findings on some of the others, correct?
Correct.
And what did they reflect in your experience as far as her injury goes?
From what I can recall, I know she had a thoracic spine injury.
We need the ER nurses
And
to
how
chime
about the
in here.
CT that was done of the chest area?
I don't recall.
If I may approach.
Doc didn't prep for this trial. She probably, blocked it out. Probably didn't want to be here.
Yeah.
Does that refresh your memory?
Yes.
And what was the extent of the result from the chest CT?
So it talks about her thoracic spine injuries.
Okay. Now, after reviewing all of the images, all of the CT scans that were done here, the cervical spine, the head CTs, the thoracic spine, what was the plan for this particular patient? Was she able to be treated further at South Shore Hospital?
The decision was made by the team that her injuries were too severe to stay at South Shore Hospital, and the decision was made to transfer her to a tertiary care center.
Were you able to stabilize her before transporting?
Yes.
Is that something that's important to make sure a patient is stable before sending them off in the ambulance or a helicopter?
Yes.
And so as far as this particular patient goes, are you aware of whether any surgical intervention had to be done before she was stabilized and transported?
I was not aware of any intervention being done.
And again, you had Dr. Carpio, who was also there to assess that.
Correct. We work as a team.
Kind of going back to those injuries on her neck and her wrist very briefly. Can you explain to us the difference between bleeding in maybe an artery or a vein and how that might present itself in an emergency situation?
Venous bleed would be a little bit slower, darker blood, and arterial bleed would be pulsatile and bright red.
And is it fair to say that when you strike either an artery or a vein that they're of different pressure systems, and so the manner in which the blood comes out is different?
Yes.
In either circumstance where an artery or a vein is struck or nicked or cut, would that be something that you'd have to stabilize for?
I'm going to get a penny jar for every time the prosecutor says, and we go, like, come on, you're doing a triple murder here of children. Get it together.
Patient in order to make sure that they don't bleed out.
Yes.
Was that done here?
It wasn't necessary.
Now, this particular patient at some point was noted to be, I think it was referred to as hypothermic.
Mm-hmm.
Do you recall that?
Yes.
Do you recall at what point in your treatment of her was that noted? Was it as she was coming into the emergency department, or did that develop while she was in the emergency department?
I don't recall.
What was the course of treatment for a low body temperature?
We placed something called a bear hugger on them, which is a warming blanket.
And can you explain to us what could cause a person's body temperature to drop to, I think it was 82.1?
There are many reasons, but it could be a metabolic disarray or exposure.
In this circumstance, did you know what the source of the drop in the body temperature was for Ms. Clancy?
No.
And do you recall how long she was in the emergency department before she was transported, approximately, to the Brigham?
I think it was about 4 hours.
At this time, Your Honor, I would move to enter into evidence a copy of the South Shore Hospital medical records for Lindsay Clancy from January 24th, 23 as the next exhibit.
Is that by agreement? All right. That may be admitted. Or they may be admitted.
And I would also move to enter as the next exhibit a certified copy of imaging records from the South Shore Hospital for Lindsay Clancy from January 24th, 2023.
All right. It may be admitted.
You, just you,
So
building your app.
the prosecutor, the question she's asking, I just don't know. But Attorney Reddington did say to one of the paramedics, Lindsay, could she have had hypothermia? And that's why her wrists weren't bleeding. The doctor already said here that they were superficial, but the prosecutor put so much on the jury about the bleeding wounds. And now she did have hypothermia.
So finally, Dr. McDonough, did this defendant receive surgery at South Shore Hospital?
Not that I'm aware.
Okay. Did you observe any cuts, abrasions, or blood on the area of her head?
No.
And based on your review of those findings on the CT scans, was there any noted injury from the head CTs that you could tell?
No.
And were you able, after using that bear hugger device, able to get her her core body temperature back up to normal?
I don't recall.
Did you ever observe those wounds that you observed on her neck or her wrists ever start bleeding actively again?
No.
I have nothing further.
Mr. Reddington.
Morning.
Morning.
So, would you agree with me that when Lindsay was brought into the South Shore Hospital that she was unconscious?
I recall her eyes being open, but she was nonverbal.
Okay. So as an experienced emergency room doctor, can you tell me when someone's unconscious, what is that? What are the symptomology of it? What does that mean?
Usually means they're completely unresponsive with eyes closed.
Okay. Was she responsive?
Not verbally.
Was she responsive at all?
She was responsive to pain.
So that means that you would do something to cause pain, perhaps the bottom of the foot or whatever it is, to see if they have a reaction.
Correct.
And would you agree with me that when people even have very, very serious brain injuries, that they can respond to pain stimuli?
Sometimes.
Sometimes. So her eyes were open. Were her pupils equal and reactive to light?
I don't recall.
Kevin Reddington is just...
You don't recall.
Good.
What does it mean with PERL, pupils equal reactive to light? What does that mean?
Exactly what you just said. It means her pupils are equal and reactive to light.
And as a doctor, what does that tell you?
It tells me that there's no significant neurologic injury.
And in this case, you don't recall if her pupils were equal or reactive to light?
I don't.
Okay. And that's when you take the little flashlight sometimes and you put it over the eye and see if there's constriction of the pupil.
Correct.
Did you do additional evaluations of her to see what her neurological function was?
She was pretty quickly intubated from what I recall, so after that it would be difficult to assess her neurologically.
Sure. Was she on any pain medication, if you remember?
I don't remember.
You recall, did she have difficulty being intubated? I mean, would you agree with me that if you're not under some type of medication or sedation or unconscious, it hurts to be intubated, doesn't it?
We wouldn't intubate somebody without first giving them some induction medicines.
Okay. So what would the induction medicines be?
They're not universal.
Well,
That would depend on the
What are
case.
the induction medicines that you used on Lindsay Clancy?
I don't know. I'd have to refer to my record, and also I wasn't the one who did the intubation.
So she was intubated, had the tube coming out of her mouth, she's laying on the table, and you are continuing an assessment. You were the lead doctor in the emergency room for Lindsay Clancy, right?
I wouldn't say I was the lead. I think the trauma surgeon and I worked together.
Right. Her temperature, her core body temperature was 82 degrees, is that right?
If that's what the record states, then yes.
I'm sorry?
If that's what her medical record states, then
Well,
yes.
as you sit here, you don't know what her core body temperature was?
I saw her 3 years ago. I see about 200 patients a
I'm
month.
sure you're very busy, but this is a murder trial, doctor. Did you review your records and your notes?
I'm happy to look at my record if you bring it
Did
here.
you review your records and notes before you came in here today to testify on this case?
Sir, I did, but I don't have a photographic memory.
Did she regain consciousness at all while she was in your emergency room?
No.
Can you tell me what CSF is?
Cerebrospinal fluid?
Yeah. Is that what that is? CSF?
It could be. I'm not sure in what context you're referring to it.
Well, how about if there's a massive leakage of CSF from her nose? What does that tell you as a doctor?
It could mean that there's a skull fracture.
Did you notice any clear fluid coming from her nose?
I did not.
Is that something you would look for?
Yes.
How quickly do you get the results of the x-rays when you're in the emergency room?
Well, these were CT scans, but fairly quickly in a trauma.
I'm sorry, CT scans, x-rays. So you had CT scans that were able to show you the damage to her neck and upper chest, is that right?
Yes.
And what did those CT scans show you?
Well, what I remember is a thoracic spine injury.
And when you say a thoracic spine injury, would you agree that the top part of your neck, your throat area, would be cervical, right?
Correct.
And that's when the numbers go C1, 2, or whatever they are. That would be the actual vertebrae in the cervical area of the upper body, correct?
Yes, the cervical spine.
Okay. And then below the cervical spine would be the thoracic spine, is that correct?
Correct.
And the thoracic spine would be, and sometimes they're delineated as T1, T2, meaning thoracic 1, thoracic 2, all the way down to what, 5 or 6?
12.
I'm sorry?
12.
12. So when you looked at, and the lower portion would be the lumbar, is that right?
Correct.
He's going
Now,
somewhere
when you
with
looked
this.
at the CAT scans, did you determine the extent of the injury to the spinal cord?
I could determine the extent of the injury to the bony thoracic spine.
Okay, what was that?
I don't recall exactly the level. I would have to look at the report.
What does that mean, the level of the T?
Correct.
Was her cervical spine injured?
I don't recall. I'd have to look at the report.
Were you aware that her thyroid was crushed?
I don't recall.
Do you know that her cervical spine
I didn't know that.
vertebrae was
took a bad fall.
was fractured, destroyed?
I don't recall.
Doesn't that control a person's breathing? Does that have anything to do with breathing?
It can.
What do you remember about looking at the damage to the spinal cord depicted on the CAT scan?
What sticks out most in my mind is her thoracic injury.
Okay, and what was the thoracic injury?
I don't recall the exact level.
What does it mean by effect
I don't
level?
recall.
The exact level.
I'm sorry. Were you aware that there was a complete transection of the spinal cord on T5 and T6?
I'm sure I was aware at the time, yes.
Okay. And just, can you tell me, what does it mean when it says a complete transection of the spinal cord at a particular, apparently that would be at thoracic.
All right, let's pause really quick. So he's not showing her the chart, right? So the nurses in the chat are saying, he's not showing her the chart. And even if she did review them, she can't remember. You see the prosecutor was showing her, like, take a look at this, and then that could refresh your memory. He's not showing her the chart because he wants to get the edge, right? So he's being very aggressive with her. He wants to get the edge. She's not breaking, but she's like...
5 and thoracic 6, right?
Mm-hmm.
What does that mean with a complete transection?
It means the bones are no longer one on top of the other. They're moved apart.
Oh.
Were you aware that there was a significant edema noted in her chest?
If that's what the report says.
Okay, and what is edema?
Swelling.
And does it also refer to fluid?
It can.
Did it refer to fluid in this case?
I'm not sure. I would have to read the report.
So in addition to the edema that was noted, was there edema noted around C7, T1, T2, T3 to T4?
Again, I would have to have the report in front of me.
When you noted her
don't want to give that report
base
up.
temperature as being 82 degrees, what does that tell you as a doctor?
It means that her body...
He does not want to give that report up.
temperature is lower than normal.
And what is normal?
98.6.
And if a person goes from 98.6 to 82 degrees before you place her in the bear hugger, what does that tell you? Does that affect the body at all?
Yes, the body works ideally at 98.6. So anything outside of that range, not ideal.
To what effect, as a doctor? What effect, if any, on the body? If a person has an 82 degrees base...
This doctor is not trying to give him anything. She is not. She's not trying to give him anything.
The list of things that could go awry is quite long.
Can you give me an idea, maybe the top three?
She could have a metabolic derangement,
What's a metabolic derangement?
meaning her body wouldn't be processing things the way that it was before. Her cells are not working the way that they should because it's too cold.
Would you agree with me that when you were looking at the injuries to the wrist...
I knew it. I knew it. I knew he was coming with the wrist was not bleeding because of the hypothermia. Ugh. Kevin Reddington is really good. It's really good.
Both wrists, actually. You noted lacerations in the volar aspect of the wrist?
Yes.
What is a volar? What does that mean?
It's the anterior aspect.
Interior? Okay, thank you. Would you agree that on both wrists there was deep laceration?
I wouldn't characterize them as deep.
You would not? And when you made reference to her being transferred to a tertiary care center, what does that mean?
It means that it's a hospital that has more services and specialized care than we do at our hospital.
Now, when she was at the South Shore Hospital, counsel asked you about whether or not you noted any injuries to her head. You did not notice any bleeding or scrapes or bruises of that nature, right?
Not that I recall.
Did you notice any injuries to her lower body, her legs, her feet, let's say her feet or her buttocks?
I don't recall.
He getting aggravated with the don't recall or show her the medical
At any
records.
time while she was at South Shore Hospital, did she have a cardiac arrest?
Not that I recall.
Do you know she had a cardiac arrest when brought to the Boston Hospital?
Did not know that.
How about blood? Was there any blood transfusion at South Shore Hospital Medical Center?
I don't recall.
Were you aware that she had a massive transfusion of blood once she hit Brigham and Women's?
No.
What does that tell you? Massive transfusion of blood. What does that mean?
I couldn't comment on why they gave it to her.
All right, let's pause right here, Nurse Gang. So it looks like his theories are, I don't know, they're supported here right now. Hypothermia. They said she had hypothermia, and now he's going with the, putting that doubt out there, like she was bleeding so bad because it was a true suicide attempt that she needed a blood transfusion when she got to the Brigham. I don't know. Drop your thoughts in the chat. Let's get into it.
Were the police in the hospital when she was there with you?
I don't recall.
Was she chained to the bed by handcuffs?
I don't recall.
Go ahead.
He's aggravated.
You read it?
Very briefly.
He is aggravated with this doctor.
Dr. McDonough, I'm just gonna give you your notes if that's okay.
Sure, thank you.
Just take a look at it and then take your time and just look up when you're done.
Doc's not trying to incriminate herself. And she's
The
like,
way estrogen drops when you're...
The doc is not trying to incriminate herself. She's like, I don't recall. Like, I'm not getting into, like, I'm not saying what I don't know. Maybe she doesn't recall, though. She's not trying to get into what she doesn't know. Let's get back into it.
You need this
You
one.
want to just flip through the rest of them to see if that's the extent of the note that you had in the records.
The doc did not fold under pressure, I tell you. She did not. She did not fold under pressure. She kept, I do not recall.
Okay. Thank you.
Now, counsel asked you on cross-examination about pupils, right?
Mm-hmm.
Was there anything notable, according to your now review of the notes, about Lindsay Clancy's pupils?
No.
So what did that tell you about a possible head injury?
It just indicates that there's no obvious head injury or brain herniation.
Now, you indicated that she was somewhat unresponsive, but her eyes were open. She was nonverbal, correct?
Correct.
Did you observe her to be moving her arms around at various points?
She did move her arms on exam in response to painful stimuli.
And as far as the intubation goes, you're aware that she was in fact sedated in order to maintain intubation.
Again, I'm not certain of that because I was not the one who performed the intubation.
Okay. And you were asked about CSF. Having now kind of looked through your notes with your interaction with this patient, was there any note of cerebral spinal fluid, in either your assessment of them or your review of any of the CT results?
I didn't see any mention of that in my physical exam.
Now, as an emergency department physician, you're not treating all of these spinal injuries, correct?
Correct.
Your focus is to assess,
CJP
stabilize, and get them where they need to go.
We got to
right?
watch together.
And so
every
that's what you
day.
did with Miss Clancy.
Correct.
When the injuries that were described as a volar aspect, counsel mentioned that terminology to you, right?
Yes.
You've now in direct examination identified those injuries as superficial. What characteristics make you say superficial?
Because I wasn't able to visualize any active bleeding or muscle tissue or injury to tendons.
And is it fair to say that oftentimes patients that come into the emergency department might be, if they have some sort of injury to their spine, you don't want them to move, right?
Correct.
So they might be at some point kind of either put in soft restraints or restricted on the bed.
Correct.
Thank you. Nothing further.
Is there anything further? All right, thank you, Doc.
Wow, so bombshell testimony today from the psychiatrist who treated her in the hospital. Some key takeaways. I'm going to look in the chat. CJP787 says, yes, no injury to tendons. That stands out to me. No injury to tendons, no injury to the muscles, making it superficial. I really wish the prosecutor would not have focused on the no bleeding because she was in a state of hypothermia. So, you know, her blood could have coagulated to prevent her from bleeding out. So the doc saying it was superficial was enough. Kevin Reddington is really good, but this was a bad tactic with the doctor. He was withholding the medical records to try to get her to say something on the stand about CSF, about, you know, the intubation meds and things like that, without showing her the notes. And she's valid, and I see 200 patients a day. How can I possibly remember what happened 3 years ago? But he's like, you were able to review this case, you were able to review your notes. What do we think about that? You know, it is a murder trial. You see a lot of patients, but not everybody is, you know, this high profile case with a murder. That's one thing that's sticking out to me too. Like she should have took a little glance, or maybe she did take a glance and say, I don't recall, I don't know, but she wasn't flustered. She stuck to her guns. I don't recall. So in wrapping up, we know it was superficial, right? It was superficial, and it's not looking like she had a head injury. It's not looking like she slit her wrist trying to kill herself and she jumped out the window head first. Those two things are just, it's looking like maybe she landed on her feet and cracked her spine. That's what it's looking like, because you know, the medical records are saying something different. You know, the medical records are definitely saying this woman did not have a head injury. The doctor played her cards right. She really did. She played her cards right. The psychiatrist was kind of she was matter of fact, just answering the questions. So Lindsay was diagnosed with delirium, but she was able to say, I have delirium. And, you know, Lindsay Clancy was a nurse. Like, she was a nurse for a very long time. So, you know, I don't know. But we will be back tomorrow, same time, well, in the morning for, we will be back tomorrow morning for live testimony tomorrow. I do think we should be seeing more of the psychiatrist. Definitely waiting to hear from the psychiatrist that actually treated her personal psychiatrist. I'm hoping they're on the witness list.
Students with ADHD save 10 hours.
I will see you guys
studying with this
tomorrow. Thank you for hanging out with me.
By all means.